What's up, people? It is Mental Health Monday. I hope that everyone had a wonderful weekend and you're taking care of your mental, physical, and spiritual health. This is Demetra back at you. Let's get this party started. Okay, during the last couple of weeks, we had a lot going on. There was a women's special. There was also a special on narcissistic personality disorder. And this week, we're going to be discussing primarily borderline personality disorder. However, we need to go over how these disorders are broken down. And we'll start with cluster one, which is characterized by odd, eccentric thinking or behavior. They include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. That's cluster A. Now, personality disorders are grouped into these three clusters based on similar characteristics and symptoms. Many people with one personality disorder also have signs and symptoms of at least one additional personality disorder. It is not necessary to exhibit all the signs and symptoms listed for a disorder to be diagnosed. Now, back to the clusters. Cluster B is characterized by dramatic, overly emotional, or unpredictable thinking or behavior. I'm going to come back to that just a little bit later. But they include antisocial personality disorder, borderline personality disorder, which is our focus for today, histrionic personality disorder, and narcissistic personality disorder, which we discussed with our professional last week. Cluster C, characterized by anxious, fearful thinking or behavior. They include avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. So now I'm going to back up a bit because our focus is on borderline personality disorder. Just like with high blood pressure, some people experience headaches, nosebleeds, or shortness of breath with high blood pressure, but most people who have high blood pressure do not have symptoms. This is why it's sometimes called the silent killer, and very important to have our blood pressure checked regularly, as well as know the foods that can cause high blood pressure, with the understanding that anything above 120 over 80 is considered higher than normal. Now we're going to focus in on this word unpredictable as it relates to borderline personality disorder or anything under cluster B. Unpredictable is described as something that's unexpected or not known in advance. Here are some examples. Having a loved one walk out on you in the middle of an emotional breakdown without explanation. Another one is a known adversary decides to become friendly as if you've been friends for years. Number three example, a friend suddenly stops communicating with you without explanation. And these are actually personal experiences. Can a personality disorder affect relationships? Absolutely. Here are a few quotes from some notable sources. People with borderline personality disorder often have rocky relationships, both romantic and platonic. Romantic relationships present a unique set of challenges for people with borderline personality disorder and their partners. When it comes to relationships, everybody's relationship is different. So there are going to be unique circumstances that go along with your relationship. And some of these present challenges for people who have borderline personality disorder. Number two, by definition, people with antisocial personality disorder. They don't follow society's norms, are deceitful and experience intimidation in relationships, and are inconsiderate of the rights of others. People with this type of personality may take part in criminal activity, but if they do, they are not sorry for their hurtful deeds. They can be impulsive, reckless, and sometimes violent. This disorder is far more common and more apparent in men than women. Number 3, histrionic personality disorder is a condition where individuals constantly seek attention and exhibit extreme emotions. These emotions are often used to manipulate others into keeping the attention on the individual. People with histrionic personality disorder try to be the center of attention in any situation and can grow uncomfortable when they are not. I call all three of these the cousins to narcissistic personality disorder. Can alcohol and substance abuse cause mental illness or a personality disorder? Yes and no. Alcohol and substance abuse in and of itself is an illness. Let me repeat that. Alcohol and substance abuse in and of itself is a disorder. So here are a couple more examples from some notable sources. Mental illness associated with alcohol addiction may be dependent on the symptoms prior to the alcohol consumption and or occur directly because of it. Having knowledge of the patient's family history, gender, and length of illness helps bring an understanding to the diagnosis. Alcohol-induced mental illness is due to neurotransmitters being affected and or the hormonal imbalance that are associated with other mood disorders. Alcohol addiction can lead to permanent brain damage. According to the National Institute on Drug Abuse, drug addiction is classified as a mental illness because addiction changes the brain in fundamental ways, disturbing a person's normal hierarchy of needs and desires and substituting new priorities connected with procuring and using drugs. The resulting compulsive behaviors that override the ability to control impulses despite the consequences are similar to hallmarks of other mental illnesses. Please make note of those sources. Specifically as it relates to borderline personality disorder, is the most prevalent or widespread and the most serious out of all the personality disorders, as it is commonly associated with self-harm behavior and often co-occurs with other impulsive disorders such as eating disorders and substance abuse disorder. When borderline personality exists with another mental health disorder, such as substance abuse disorder, this is known as co-occurring disorder. As it relates to borderline personality disorder, did you know 1.4% of the U.S. adult population experiences borderline personality disorder? Nearly 75% diagnosed with borderline personality disorder are women. Men may be equally affected, but are commonly misdiagnosed with PTSD or depression. And here are a list of borderline personality disorder symptoms, but keep in mind, all symptoms may not be present. Only a professional mental health expert can determine whether someone has borderline personality disorder. And so the symptoms are frantic efforts to avoid real or imagined abandonment by friends and family, unstable personal relationships that alter between idealization and devaluation, distorted and unstable self-image, impulsive behaviors that can have dangerous outcomes, self-harming behaviors, periods of intense depressed mood, irritability, or anxiety lasting a few hours to a few days, chronic feelings of boredom or emptiness, inappropriate, intense, or uncontrollable anger, often followed by shame and guilt, disassociative feelings. Now, I'm going to focus on dissociative feelings because there is a dissociative disorder, which is another mental disorder that involve experiencing a disconnection and lack of continuity between thoughts, memories, surroundings, actions, and identity. People with dissociative disorders escape reality in ways that are involuntary and unhealthy and cause problems with functioning in everyday life. However, as it relates to borderline personality disorder, dissociative symptoms are common, including memory loss or amnesia for certain time periods, events, and people, a sense of being detached from self, depersonalization, derealization, perception of people and things as distorted and unreal, blurred sense, of identity. Borderline personality disorder is a serious illness. Here are some causes for borderline personality disorder. Some scientists agree that it is the result of a combination of factors, including genetics. Some people with a close family member with borderline personality may be at higher risk. Environmental factors such as trauma, brain function, suggesting that there is a neurological basis for some of the symptoms. With African Americans not having the best history as far as mental health, it is imperative that we take heed to this information and do our level best to determine if there are some personality disorders or other mental illnesses that may be within our families or even affecting ourselves. Diagnosis and treatment for borderline personality disorders. The diagnosis must be, let me repeat, it must be conducted by a mental health professional following a comprehensive clinical interview. Let's not try to self-diagnose. If we are suspicious that we may be having trouble with our mental health, please seek a professional. Treatment may include psychotherapy, or even medications. As previously mentioned, many with borderline personality disorder also experience additional conditions. As mentioned previously, let's not self-diagnose borderline personality disorder. Seek help. If you're aware or notice signs or symptoms in a family member or friend, reach out to your primary care provider or a mental health professional. If you have suicidal thoughts, fantasies, or mental images about hurting yourself, please dial 911 or the suicide hotline number at 1-800-273-8255. Again, that's 1-800-273-8255. Reach out to a loved one, close friend, or someone from your faith community. Keeping in mind, your mental health affects your physical health. Let's make it a priority to have a happy, healthy, functioning mind. Okay, that's it from Mental Health Monday, brought to you by yours truly, Demetra. Have a wonderful week. Aha!